So the normal foot has arches in the foot, and that means that the instep does not touch the floor. And that's a combination of the bony shape of the bones in the foot, the muscles, the ligaments, and the tendons, which create an arch, which is really important because it's your spring in your step. And when the arch collapses and the instep touches the floor, that's what we call flat feet. So up until the age of, say, 4 or so, almost all children have flat feet. So it's entirely normal. Between the ages of 5 and 10, as the child grows, the arches also start to develop. And by the age of 10, perhaps about 20% of children have flat feet, which is similar, in fact, to the number of adults with flat feet. Called it demonstrandum, I think. If you ask your child to stand on their tiptoes and their foot arches recreate, then they have what's known as flexible flat feet, which suggests the cause is flexibility of the joints or weak muscles. If the arch does not recreate, then this is known as fixed flat feet. And I'd recommend then you get seen by a specialist to investigate the underlying cause, because many of them can be treated if they're picked up early. Well, I think most children with flat feet will have no symptoms whatsoever, and they can go on to adulthood without any problems at all. So, after all, the fastest man on earth, Usain Bolt, has flat feet, and it's never caused him any problems. Now, in a number of children, a small number perhaps, flat feet can be associated with hypermobility, knee pain, back pain, and in those circumstances, the child should really see a specialist because there's lots of help available. So the most important thing for children is physical activity, especially of the balance muscles, such as walking on tiptoes, and fun exercises such as picking up objects with the feet, and balance exercises with, say, a physiotherapist. Insoles sometimes can help because they can bring the floor to the foot as opposed to the foot collapsing down to the floor. Now, in some cases, the child's feet are so flexible, even insoles don't help, and they have ongoing problems. And in those cases, we have sometimes to add in a small surgical procedure called an arthroresis, which is a small implant that we place into the back of the ankle, and it helps control the collapsed arch. But it's really important to stress that both insoles and surgery, they augment, which is a technical term to mean assist, but they don't replace the need for the exercises, daily exercises, and physiotherapy, which is the most important thing.